Every single time a medical claim slips through the cracks, your practice loses revenue that you have already earned. Historical claim denial rates hit an 11.8% peak in 2024, creating a $20 billion rework burden nationally. At the practice level, reworking just one commercial claim denial costs an average of $63.76. If your practice is in Georgia, the margin for error is exceptionally tight. Many states allow up to 12 months for Medicaid timely filing. Georgia limits you to 180 days. On top of that compressed window, your Medicaid patients are split across Amerigroup, CareSource, and the Peach State Health Plan. Each of those organizations has its own submission portal and its own documentation rules. A standard billing workflow simply cannot track all of these accelerated deadlines. When a claim misses a 180-day window, that revenue becomes permanently unrecoverable. Practices lose about 1/3 of their billing support staff every year, creating a corresponding dip in practice revenue. Replacing each departing biller carries a hard cost of $9,000 to $12,000 in training expenses. You also lose the invisible assets, the specific Georgia managed care workarounds and electronic medical record quirks that a biller learned through months of trial and error simply walk out the office door with them. A new hire then has to navigate complex state regulations, like the 2026 Group Billing Enrollment Requirement. If your team missed that registration deadline, your claims are already being denied. Even a short staffing gap is dangerous. Peach State Health Plan enforces a strict 30-day appeal window for denied claims. If a desk sits empty for a few weeks, those critical deadlines permanently pass you by. Expecting generalist in-house staff to manage this environment leads to a constant cycle of rehiring, retraining, and watching valid claims expire. Practices keeping their denial rates under 5% solve this by abandoning the one-size-fits-all approach entirely. Claims are split into separate routing pathways for Medicare, workers' comp, and Georgia Medicare MCOs. Next, a predictive validation gate scrubs the claims, flagging missing authorizations or incorrect modifiers. This early scrubbing prevents up to 85% of avoidable denials. After submission, dedicated staff monitor the accounts receivable in the critical 30 to 60-day window, catching stalled claims before they hit high-risk aging territory. Specialized routing and predictive validation allow you to proactively beat Georgia's strict compliance clocks, rather than fighting denials after the fact. Building that kind of specialized workflow in-house is difficult. Many practices opt to outsource to a dedicated, localized billing team instead of a generic processing pool. A dedicated team works directly inside your existing EMR. They learn your clinical team's preferences, your patient mix, and your specific documentation habits. Instead of a generalist, you get specialists with AAPC and AHIMA certifications, bringing day-one expertise with the GAMUS portal and Georgia managed care organizations. Deploying this infrastructure does not take months. A specialized team can go live in exactly 14 days. They handle EMR access, execute the HIPAA agreements, complete team onboarding, and finalize workflow protocols. Total compliance is built in from the start. SOC Type 2, ISO 27001, and HITRS certifications are active and verified before the team touches a single claim. This model immediately injects highly trained Georgia billing expertise directly into your operations, bypassing the delays and costs of traditional hiring. An in-house biller costs $55,000 to $75,000 a year. Add $9,000 to $12,000 in replacement costs when they leave. Conversely, an outsourced dedicated team costs a flat $399 a week, roughly $20,748 annually. That structure yields an approximate 60 to 70% reduction in your total billing department costs. You also gain full transparency without needing to micromanage. Weekly KPI dashboards track your exact throughput, turnaround times, and accuracy rates. Outsourcing takes revenue cycle management from a volatile, high-risk variable expense and turns it into a highly predictable, low-cost fixed line item. If your practice is currently running a claim denial rate above 5%, your current workflow is leaking revenue. If your accounts receivable consistently stretch past the 40-day mark, your cash flow is unnecessarily exposed to timely filing deadlines. And if you are constantly losing front office staff and being forced to rebuild your institutional knowledge from scratch, the internal model is failing you. Continuing to out-hire the problem is mathematically unsound in Georgia's complex 2026 billing landscape. You need an efficient system to navigate the friction. There is a zero-risk way to fix this. You can start a 30-day free trial with a dedicated team, requiring no long-term contracts. The exact next step is to book a 30-minute strategy call to build a specific working plan for your clinic.